Hello, it's Ellen Lucy here, and today's mini workshop is going to focus on working with birth parents. Today, what Lucy and I are going to do is a little bit of a role play, and it's an exercise that we actually do in our Skills to Foster training, which is the training that we offer all prospective foster carers whilst they are exploring whether or not they'd like to foster, and it happens before they come to panel to be approved. So we're going to do a mini role play. I'm going to role play a parent whose 6-year-old daughter needs to be looked after by Lucy as the foster carer. We're not going to go into the reasons why, because it could be many in theory. We're going to look at some of the day-to-day decisions and involvements that I might like, quite understandably, as a parent. So bear with us. Thank you. So Lucy, my daughter's going to be looked after by you. And I really think it's important that I have a say in what she eats. I've always thought she might have a bit of an intolerance towards dairy, and I'm worried that information is not going to get through to you. So how are you going to make sure she eats properly?
Yes, so your daughter's dietary requirements will be a big part of her care plan, and those are the guidelines that I sort of follow when I'm providing care for her. So in the same way that a child with certain religious or cultural requirements, you would adapt for that diet in as far as you can as a carer, we would do the same for your daughter. It might also be worth, as part of that plan, looking into taking her to the doctor to assess whether she does have a dairy intolerance and responding to that, and to make sure that we're giving her a diet that has everything she needs. Obviously, making sure that she's getting the right vitamins and minerals for her bones that dairy would otherwise give you. So yeah, it would work around that plan.
She really likes spaghetti hoops. Are you all right with that?
Yeah, fine with spaghetti hoops. We tend to be led quite a lot by the children. All foster carers want to provide a healthy, home-cooked, good wide variety of fruit and vegetables, that sort of diet for their children. But actually it's really important, especially in the early days, that your daughter feels comfortable and that there are some familiar things, and getting foods in that that child's going to like is a really good way. So it's really useful to have you contribute to that and tell us what she likes.
Good. Now, obviously, I know she's not living with me, and there are reasons for that, and I understand that probably means I can't phone her whenever I want to, but I'm going to really miss her, and I'm going to miss hearing her voice. She's been with me for 6 years, and it's going to kill me not to be able to talk to her when I want. So what are going to be the rules around me phoning her?
I think what would be really useful, probably for you and your daughter, would be to try and establish a regular time that you call. So I could feed into that by sort of letting you know what the routine was. So at 6:30, your daughter's going up to have a bath, and we're then getting ready to put her to bed. So maybe somewhere between supper and that time, where actually your daughter isn't too wound up or too tired, so you get the best of her, and your daughter knows that you're going to call, and you know that you're going to call, so everyone's expectations are met. I think we could work towards that.
Yeah, okay, thank you. And I suppose on a similar theme, I know I'm not going to be able to just see her when I want, but how's that going to work for us?
So contact between you and your daughter is something that is worked out in the plan that's put together to care for your daughter, and that contact between you and your daughter will be established in that plan and followed, and we support that. And
so that's not your decision.
It's not my decision to make as a foster carer, but it's something that you will discuss with your daughter's social worker, and you will have input into.
Okay, and you'll support me in that, will you?
I will support your daughter in that, and I will absolutely support the contact plan, but my primary concern is your daughter and how she is and how she's coping with it.
Yeah, thank you.
Good.
Okay, she's really choosy about her clothes, so my next question is, she doesn't really like things that are tight-fitting. I've always chosen her clothes before, so how will that work when she's not living with me?
So I think choosing clothes together with your daughter is a lovely thing, a very important thing. I understand you'd want to do that. I'm sure you would also agree, though, that there are going to be times when clothing gets ripped or becomes too small or is dirty, you need to replace it, where actually I'll need to make a quick decision and buy something with your daughter, make sure she likes it and that it sort of fits nicely and all the rest of it. However, what would be really nice is if you could continue to buy clothes for her that you could give her when you see her, and we'll make sure that we look after them and that your daughter wears them when she wants to.
Good, thank you. I've always liked her hair long, so my next question is it up to me to decide when she next gets her hair cut?
I think, let me turn that on its head a little bit. I would not make any decision to give your daughter a drastic haircut. I completely respect and understand that you'd want your daughter's hair to remain as you like it and as she likes it. However, there might be an occasion where her fringe is getting a bit long, it's in her eyes, it's causing her, discomfort, and I hope that I would be able to take her and get her trim as you'd expect.
Yeah, I think that's fine. Thank you. Obviously, I want her to do well right across the board. I want her to be happy. I want her to do well at school, and I'd be really interested in being able to go to her parents' evening. I know I can't take her to school, and that's not practical anymore. But I'd like to go to parents' evening at school. Can I come along to that?
Yeah, I think that's really great. It's really great to have parents involved in the education of the children, and obviously also as a foster carer, I'm going to be really heavily involved in advocating for your daughter's educational needs, in making sure that they're reading and they're writing and they're doing their homework, so I'll also want to be a part of that conversation. So if it's something we can do together, great. But if it's not, schools often have facility to see people separately, and there's no way that there's no reason why we couldn't both be involved in some of those decisions and conversations with teachers.
Good, thank you. I worry about her getting poorly, and I want to make sure that if she's poorly, she goes to see the doctor, and if her tooth's hurting, you take her to the dentist, and she'll worry if I'm not there, because I've always been there for those things. So can I come to the dentist or the doctors with you and her?
Well, I think it's really important that we differentiate between sort of some of the treatments we might expect. So on a day-to-day basis, your daughter might come down with a very sudden fever and a rash. I might be very worried. I'm going to prioritise your daughter's medical need and get her rushed to the hospital.
I would.
And I wouldn't be phoning you to get you to come along at that point. However, there might be other opportunities where there's longer term plans. So for instance, maybe your daughter needs a brace in a couple of years' time, and there's a plan in place for that. And I think those sorts of planned appointments are really, there's no reason why you wouldn't be able to come along to those. But I think the agreement would be keeping you informed, keeping you present as you can be, but always the needs of your daughter are going to trump that, if you like.
I'd want them to come first.
Good.
Okay, thank you. She's going to be 7 soon, and it will be the first birthday that she hasn't been at home, and I think it'd be really natural for me to want to be there for a birthday party. So how can we work that out?
So I would probably suggest birthday parties aren't really the best environment for you to have that contact with your daughter that you'll be looking for and that she'd be looking for, because there'll be loads of kids running around, it'll be chaotic, maybe your daughter will be wound up, maybe actually it won't be the best thing. So what I would probably suggest, if you were happy, was maybe you do something with your daughter on her birthday, or you agree when that might happen, where it's just more the two of you, or a smaller group where it's manageable, and maybe then the party happens and can be a separate thing, a separate world of chaos that would be easier to handle for her without having to sort of manage you and your
difficult. Okay. Now I know she's no angel, and sometimes she plays up, but I don't want you hitting her. and I don't want you shutting her in rooms. So what are you going to do when she's naughty?
So first of all, we'd never hit a child, and a child in foster carers cannot hit children. What I personally work with is having a set of very clear, very firm boundaries that your daughter will be aware of, that will be, the reasons for them will be explained, so you're not arbitrarily laying down the law. Usually we would use sort of rewards for good behaviour, but also there'd be consequences for rules that are broken, and boundaries that are overstepped. And just, initially we'd expect those to be pushed against, but just by doing them week in, week out, day in, day out, I think that consistency would really help. And certainly you would never need to smack a child.
Okay.
And, at meetings where we were all present, we could maybe talk about some of those disciplines, what's working, what's not working. So if the plan is for your daughter to come back to you, you can also learn from what we've learnt about what works with her particularly and what doesn't.
Yeah.
So we'd share that with you.
Okay, all right. Well, my final question is, her birthday's coming up and she's gone on for ages about having her ears pierced, and I'd quite like to take her to have her ears pierced for her birthday.
So I'm going to talk to you now, because I do feel quite strongly about ear piercing, weirdly, and that actually 6 is way too young for a child to have their ears pierced. So what I would do in that situation, I would require the child's social worker to get involved and make that decision, so that it was taken out of my hands, and that whatever happened wasn't coloured by my own sort of view about that.
Okay. Well, there's a very reasonable parent and a very reasonable foster carer, and we're back to being Ellen Lucy. And I hope this exercise has just shown you some of the sort of day-to-day decisions and that might need a bit of negotiation. And obviously there are so many different circumstances that bring children into foster care. And with some situations, it will be really easy to be able to work alongside a parent like this. In other situations, a parent might not be able to have any contact with their child. And that's part of the consideration that you need to make when you're thinking about becoming a foster carer and thinking about who is the right child for you. And whenever requests for children come through to us as an agency, we always have some idea about how and to what extent we might be working with the children's parents. It all depends on the plan for them. But that's just a little run through, and we hope it's been helpful for you. And please do keep tuned in for the rest of our series. Thanks.